Hi friends, welcome to this instructional video on diaphragmatic breathing. So thanks so much for tuning into the podcast and having a listen and taking some of the tips that I'm giving you. This one is a really good one. Diaphragmatic breathing is a really awesome move. As I explained in the podcast, it helps to relax your body, lowers your heart rate, releases tension from especially your shoulders and kind of that high chest breathing. Now it's a really simple movement to do because you can do it pretty much anywhere that you've got space to either lay down flat on your stomach or lay with your knees bent. We're going to do it two ways. I'll demonstrate it because if you're someone who does not feel comfortable laying on their front and feeling their chest on the ground, we have an alternative for you. But we're going to start with the, I guess the standard variation of it, which is laying face down on the floor. You want to cross your hands and just rest your forehead on your hands, just like that. You want to be relaxed, so the tops of your feet are going to be resting on your floor as well. And what you're going to do is breathe in through your nose, just nice and slowly. So if you do like a 5-second count, it doesn't have to be like abnormally long breaths. This is not about trying to breathe super deep. It's just about trying to get your rib cage to expand sideways and your stomach to expand out. So that's the reason we lay stomach down on the floor, because when you lay down stomach down on the floor, you can feel when your stomach starts to move when you breathe. It's a really good tactile response. The floor tells you whether you're breathing and your chest is moving or whether you're breathing and your stomach is moving. It's a really cool little trick. So we're down on our stomach, and what you want to think about as you breathe in through your nose is filling your stomach up and just feeling your stomach push down on the ground and your body just rise up, but rising up in your stomach area. So we're going to go breathing in, breathing out through the mouth. In through the nose, out through the mouth. Yeah, you might not be able to see the movement too much. So I'm going to turn sideways for you. And we're going to do the same thing again. And I want you to see if you can watch where my body is rising up, which is going to be around this area here. So just breathing in through the nose and out through the mouth. In through the nose, out through the mouth. So hopefully you could kind of see that. Now the second way to do it is on your back. Now it's usually best to do it with your knees bent at a 90 degree by resting them on something. So here's a little something I prepared earlier. So if you don't have an exercise ball, a chair works really well, the edge of your bed, just something where you can get a bend here in your knees. Now this one is referred to as 90-90 breathing because you've got a 90-degree bend and a 90-degree bend here. And it's going to work exactly the same, except you're going to rest your hands on your stomach. So this way you're going to use your hands to let you know that your stomach is doing the breathing and that your chest is not doing the breathing. So it's going to work exactly the same way. You're going to breathe in through your nose, feel your hands lift up, breathe out through your mouth. Right, so give either one of those a go. You go now. Don't come back. It's coming back. They're going to essentially work in the same way. maybe if you're feeling challenged to tell when you're laying on your stomach, if you can feel your stomach moving when you breathe, to lay on your back and do it with your hands on your stomach, just to get a bit more of a response, easier response to feel with our hands, because our hands are very good at feeling things. So you want to practice this. Go for 60 seconds. So it's not about the amount of breaths that you do, anything like that. Just start, lay there for 60 seconds and just practice breathing like that. I would recommend doing it first thing in the morning when you wake up. And if you are someone who chest binds, do it before you put your binder on. So it's a good one to, if you do it, like in bed. If you're laying on your stomach and you're in bed and you've got a soft bed, it might not work so well because you might sink a little bit. You might not get that tactile response that you're hoping for. So maybe lay on your bedroom floor or lay on the floor on your back and use your bed to rest your legs on. But do it first thing in the morning when you wake up. And like I said, if you're someone who chest binds, do it before you put your binder on. And do it in the evening before you go to bed. Same thing again. If you are someone who chest binds, do it after you've taken your binder off. The reason being that if you're binding, you're not going to be able to get that same sort of expansion through your ribs. It's just not going to let it happen. So it's a really good opportunity to let the intercostals, the little muscles that live in between your ribs that help your rib cage expand, give them a break and give them a bit of movement. It's a really good one for that. So yeah, 60 seconds in the morning, 60 seconds in the evening when you wake up and when you go to bed, and just see how that feels. And you can try it out once a week, you can try it out, once a day, you can try it out twice a day, you can try it out, do 7 days and just test it out. Do it for at least that and you'll notice a difference. And if you can't do it in the morning and evening, just pick one that you feel most comfortable doing. Don't feel like you have to do it all the time, but just when you think about it and see how that goes. Alrighty friends, I hope you enjoy that and have an amazing day, night, morning, evening, wherever it is that you may be watching this video. See you later.